defective. These are also the kind of effects you would expect if the mucous membrane is irritated. So there's really very little difference in what the individual would feel when exposed. These effects are expected to be transient, and the reason for this is the kinds of characteristics of these chemical compounds. They are very reactive. They last only seconds. They can affect the mucous membrane, but they do not penetrate, they are not absorbed, and they do not accumulate in the body. Clearly, because of the location of the mucous membranes, the eyes and upper airways would be expected to be affected by irritant effects. Now, I am sorry, I thought that I had changed my slides yesterday and I had to change on the computer. We now have in our study group 50 individuals. So I'm going to have to, these numbers are no longer accurate, but the bottom line of what we found is really not changed. The reported complaints are in the respiratory tract, which starts with the nose, goes down through the mouth and the upper airway. The other area that has effect is the eyes, and then there are some systemic general effects that I'll mention. You can see the kind of complaints that are reported here, affecting the sinuses, cough, irritated throat, nosebleeds. We have reports of frequent respiratory infections. I have to say that we now have 5 of these in our population, and they're all among children. And it's not likely that the children have actual infection. Infection implies viruses or bacteria. What is likely is that the symptoms are the same as one would get with an infection, but it's not a bacterial cause. It's a irritant and chemical. We have a couple patients with asthma who have noticed exacerbation of their asthma during the time that they lived in a home and were exposed to the off-gassing and drywall. Eye symptoms, red eyes with or without tearing, and also eye pain. Visual changes are reported, but since the tear film is required for good vision, if an individual has less tear production or more tear production, vision will be affected. So this may be a secondary rather than a primary effect. In our group of 50 individuals with fatigue and headache seem to be very common. We have now 18 of each in our group of 50. Very commonly reported, also reported by workers who are exposed to the weakened drywall. There are other some less common effects. Eczema is a dry flaking of the skin. It is more common in children, and it appears in kids who have lots of allergies. And this was in a child who had exacerbation of allergic type symptoms while living in the house, and her skin also showed some changes. And we have one individual who had an autoimmune disorder, that is a bowel inflammatory disease, who felt that there was exacerbation of the attacks and severity of the attack while living in a home with the person's drywall. Dr. Weiner is going to speak more extensively about how the clinical evaluations become. This gives you kind of a brief outline. We asked individuals to complete a form that we developed, a non-leading question kind of form, to try to understand what they were feeling was related to their home, what the complaints were, or the symptoms were. They were then interviewed, examined, and a differential diagnosis was formulated. Differential diagnosis to conditions means that one considers the conditions reported and tries to determine causes of these, and it would be the underlying mechanism that is leading to this condition. And in some instances, laboratory testing was done in an effort to try to determine which of the differential set of diagnoses was the accurate one. There are many causes for a lot of the kinds of symptoms that were reported, and so it want to be accurate delineating into different causes. Again, the symptoms reported by a study population follow pretty much what I had mentioned before. Eye symptoms, respiratory symptoms, headache, fatigue, and others I mentioned here. Two other ones that were described by other individuals: growth retardation, child, and corneal erosions. It is not likely that either of these has anything to do with corrosive drywall. Okay, the first thing that I tried to show in this slide was to show you that we had a diverse group of individuals. One couple has been exposed for almost 8 years to the corrosive drywall in their home, but most of the individuals have been exposed between 18 months and plus 4 years. The complaint pretty much spread throughout all of the left-hand side, as you can see. We tried to see if there were objective findings that we could coordinate with what individuals were reporting. Obviously, for headache and fatigue, there aren't any objective findings, but you can see that individuals with eye complaints, the majority of them had some redness and findings in the eyes. Those were off. Not surprisingly, had redness in the back of their throat. Of the asthma patients we had, there was one who had objective findings at the time of the examination. We tried to see whether there was any connection between the rating of the severity of the odor in the home with the physical symptoms. And what I'm trying to show you here is that in homes ranging from no odor to 3+ odor, the average number of symptoms reported in each of the occupants of the home, very, very little, depending on the odor. The types of symptoms didn't vary very, very much. They're essentially not much different. One of the good things about the people we examined was the fact that they noticed that when they left the home, they felt better. So it took a little time for some of them to feel that they had completely improved, but they would notice going away on vacation for a couple of weeks or leaving the home and staying with relatives, some of their symptoms disappeared or diminished in severity. We didn't really find much difference in how long they had been exposed and whether or not those symptoms remitted. Now, the homes were visited by a physician or another examiner so that we could look at the corrosion in the home and